As we see, all our indicators are increasing in the last couple of days, and we're seeing in Montreal is going to stay in the zone red for that time. We had 2,318 new cases in the last week. It's an average of more than 330 cases each day. And we also see an increase in our reproductive rate and the positivity rate of people who get screened. All the territories are touched by this increase, even though we see that in the west sector, all indicators are more in the orange zone, but we see that the increase is accelerating everywhere. We have some hotspots where we have an incident rate that is higher, Outremont, Montréal-Nord, et Centre-Sud. And we also see this week a repercussion on our the new hospitalization and the people that are in intensive care units. Those increases also are reflected in our outbreaks that we have to manage. We have more than 130 outbreaks currently on which we are working. 42 in schools, 18 in daycare centers, 12 in healthcare facilities and mainly private elder residency, 50 in workplaces, and 8 in community settings. What I want to say today, and my message is going to be for to be more vigilant to protect the elders. As I was saying in the last week, we see higher rates or incidence rates in the 18-34 years old group of age, and it is still present. But what we are also seeing is that the proportion of cases in the elders, 65 years old and older, is increasing rapidly. In the last week, it represented 6%, and now we have an average of it represents 12 or 15% of all our cases. And when we analyze those cases, we see that it is quite different than what we were seeing in the first wave, where it was mainly elders in CHSLD. What we are seeing is that more than half of those cases are living in private homes or in private residency, elder residency, and we have outbreaks in those in several of them. So I want to ask the population to be more vigilant, because we see that what we have seen in the general population with public health measures that were less applied, we are seeing it also with our elders living at home. So we ask people to be more vigilant. What does this mean? It means that maybe it is not secure to ask for grandpa or grandma to babysit this weekend, or even though we know that sometimes they play an important role as parents. And maybe it's not time to have a supper or a dinner with the family. And be careful, because we have had some cases of people living in intergenerational home where we see that the measures are less applied, and we see that cases that came from school are then transferred to parents and after grandparents. It is an effort that we have to do, and for parents, if your children is a case or a contact of a case in the school and they have to isolate themselves, it means they should not go and visit their grandparents. So and for the general population, I know with the new announcement that we had for schools and sports activities, it is another effort that we're asking to the population, but it is essential at this time to flatten the curve. And I think we have to remember that we will have to live with COVID-19 for a long period, several months and maybe a year, and we have to reintegrate the basic measures that are keeping our 2 meters, reducing our contacts, washing our hands, because we see that people wash less their hands, and cover your face when you are in public settings. I think those are the basic measures, but those are the measures that are combined that are the most effective. And if people have symptoms, please stay at home, get tested, and while you're waiting for your test, do not go to work and isolate yourself. I think we can go through this all by being united and by making a collective effort. It has to work. We have to see in the next 2 weeks, we have to see that our efforts do flatten the curve because we know that the consequences for our elders may be important and for our healthcare system also. Thank you.